What is an adverse health effect of air pollution? By the end of this unit, you will explain what is meant by adverse health effect of air pollution exposure. After episodes of acute exposure to air pollution in Europe between the 30s and the 50s, epidemiological research started collecting data that later offered evidence about the health effects of air pollution. In 1993, results of the first cohort studies in the United States of America were available linking air pollution and mortality from lung cancer and cardiopulmonary diseases. In the last 30 years, important statements were made by medical societies. The American Thoracic Society provided its first definition of the adverse health effects of air pollution in 1985, including a distinction between reversible and irreversible effects. The definition was mainly focused on the respiratory outcomes. At that time, the distinction between adverse and non-adverse health effects was only based on medical and pathophysiological considerations. It was in the 2000s that societal considerations, quality of life and well-being, as well as ethics and equity components were included in the definition of adverse health effects. In 2017, an updated definition was jointly developed by the European Respiratory Society and the American Thoracic Society. The scope was extended to other outcomes beyond respiratory to include cardiovascular diseases, in utero exposure and pregnancy outcomes, metabolic dysfunctions, neurological effects, and psychiatric disorders. The growing importance of the role of biomarkers for systemic conditions was also highlighted. We should look at all these definitions as a progression of new considerations added to shape a comprehensive concept of adverse health effects of air pollution, rather than each statement replacing the previously released version. The symptoms and magnitude of the health effects of air pollution can be represented as a pyramid. The less frequent and most severe health outcomes are at the top of the pyramid, and the less severe effects, which are yet experienced by a larger proportion of the population, are displayed at the bottom. At the top of the pyramid, we find premature morbidity and mortality. By definition, premature means that the event occurs at any age lower than the life expectancy of a certain population. Morbidity refers to the presence of disease and implies a decrease in the quality of life. Moving towards the base of the pyramid, we see increased hospital admissions, emergency room visits, and/or outpatient visits, which are due to the onset or exacerbation of symptoms as a result of pathophysiological changes in the cardiovascular systems or, for example, impaired lung function due to air pollution exposure. These initial changes in the body, at first undetectable at the clinical level, are called subclinical or subtle effects. Subclinical effects are manifestations that don't have recognizable clinical signs or symptoms, but which could represent the first stage and increase the risk of more severe effects in otherwise healthy people. Epidemiological and toxicological studies on air pollution are also based on these important subclinical outcomes. Some examples are heart rate variability, hyperlipidemia, or airway inflammatory biomarkers. Biomarkers are indicators of susceptibility, exposure, or effects. They can be measured, for example, in exhaled air, blood, or bronchoalveolar lavage fluid, and other fluids like urine, breast milk, and sputum. You have now completed Unit 1. Please download the reading material for further information. In the next unit, we will look at air pollution pathways from exposure to illness.